hello, everyone. It's Dr. Tamara Beckford, and welcome to the Dr. Tamara Beckford Show. I am excited. Alrighty, today it is dedicated to all our early career physicians. I know this is actually very timely, right? Because it is July at this recording. And it's we can say the middle of July, but a lot of our physicians just graduated a couple weeks ago. And we have a lot of early career physicians, right? You just finished residency, you are going out into the big world. And this is all dedicated to you on how you're going to do that balancing of the work and life. We're going to get some tips to help our early career physicians to not only survive, but to thrive, like we love to say, right? All righty. So our doc today is going to be doing all of that. She's a wonderful doc who's a graduate of the Aga Khan University in Pakistan. So, hey, all my people who went to Aga Khan, yes. Hello. One of your docs is here. She also did her residency in internal medicine at Cleveland Clinic. In addition to that, she did a fellowship at Duke University in geriatrics. Shout out to all my geriatricians. I love you guys. You know, all your peoples come to my peoples. We see you guys there in the ED. We I love my geriatric patients, by the way. I mean, they're some of my funnest patients. So I love it. She not only did that, but she also has a certificate in life coaching and wellness from the Duke University. She is the CEO of Early Career Physicians Institute, where she has a passion in helping our new attendings, just like you guys who just graduated, through post-training, the post-medical training challenges that can occur, and helping you with balancing work and your personal lives. This is the one and only Dr. Amna Shabbir. Welcome, Dr. Amna. How are you?
I am excited and happy to be here, and thank you for that kind introduction.
Hey, it's all about you. I believe that all of our stocks, we're rock stars. Rock stars come on to round of applause. So should we. Matter of fact, I should probably walk around with this button. But needless to say, thank you so much for joining us here today. I do want, to get into the early career physicians and how you're helping them, but I want to get to know you a little bit more. So let's start back at the beginning. And what made you decide to do medicine in the first place?
I was reflecting on this question prior to got on air because, you answered this question so many times. Every time there's an entry portal, you're asked that question. I am a byproduct of a dual physician household. So growing up, I saw that. But I also had some personal health challenges when I was a teenager. And I was really drawn to the way I received care from my dermatologist and how things got better from something that was really embarrassing at that time. Now, in hindsight, I can talk about it. But when that was happening, that feeling of how you are helping somebody who feels really helpless at that time. And I was a teenager, there's all these, things happening in your mind. So that drew me to think seriously about medicine. And prior to that, of course, there was the gentle nudging that my lovely South Asian mother had been doing all along the way.
Shout out to mom.
Absolutely. I was so drawn to both positive psychology and the aspects of medicine. In fact, actually, I read The 7 Habits of Highly Effective Teens. I was around 13 years old at that time. And I told my mother, I really want to learn more and do something in this. And my mom was like, I don't understand this. You're becoming a doctor, and end of story. So I think it was a good mixture of both.
I love it. It's the positive, gentle nudging. But also, I love the fact that you not just got drawn to medicine because you saw it around you. Yes, it's great that mom and dad, are doctors, but you had a personal encounter where you were being seen by someone that was not just family, that was not just mom or dad, but you had to develop that relationship and that trust during one of the most vulnerable times in your life. Because if anyone remembers teenagehood, they remember that everything is amplified, and any issues that's going on in your life, it is super dramatic, and it's amplified 10 hundredfolds. So to have someone help you through that time during your life, you relate your trust in them, and they help you to feel not just comfortable, but not just the treatment, but just the way that they made you feel during that time. I think that story, helped to guide you into this path where you now have that ability to help others during that vulnerable period in their lives. So, really, really good. Alrighty, so you're there. Got through. You got that gentle nudge. It sounds like the gentle nudge is the same gentle nudge from your mom that the mama birds give to the baby birds when they're going out the nest. There you go.
Yes, it's a very good parallel.
So we got that gentle nudge from mom about medicine, and you decide, to go in internal medicine. So tell us what it was like. Was that your thought going into med school? Oh, I'm going to do internal medicine. Or is it that you got pulled in? Was there a story? Was there patients? Like, guide us through that portion.
I did not start medicine thinking I will be an internist, and
Mm-hmm.
I have been pleasantly surprised all my life because
I love
that's
it.
not the bias I had. I
Mm-hmm.
think going in, I was really open-minded, and I was the true
Okay.
definition of open-minded. So every rotation I would go through, I'm like, well, I don't know, maybe I'm going to love this, and that's exactly what would happen. Pretty
Mm-hmm.
much all my rotations, I would call home and I'd say, "This is it. I'm doing this." And my parents were, by the time, they were both like, "Okay, just let us know at the end what you're doing." Uh, in fact, my sub internship, I did a sub internship, and all the choices that I made, I picked very different things. So I did something in infertility treatment. I did
Mm-hmm.
something in general surgery. I actually did something in psychiatry and
Mm-hmm.
anesthesiology. And so you would think there was no elective that I chose to do in internal medicine. And then I did all of it.
Mm-hmm.
And I sat down and I said, okay, what is one thing that allows me to do all of this pretty much
Mm-hmm.
in a good way? And then I think that was one question. And the second question was, I didn't, although I loved surgery and I loved being there, and as much as I love medicine, I also loved that procedural aspect of it. I just did
Mm-hmm.
not. I saw my mom go through burnout, and that was not something that I wanted to be in a procedure centered specialty. So then
Mm-hmm.
I decided, okay, internal medicine it is. And even in the residency interviews, they're looking
They're going through this like, okay, anesthesia, surgery.
what are you
I
doing
cannot
here?
imagine that interview.
You're doing consultation liaison psychiatry. So I felt that internal medicine was right there. And in internal medicine, I
Mm-hmm.
specifically wanted to do primary care. So went for the
Mm-hmm.
primary care track because I felt that chronic care management and being
Mm-hmm.
being with my patients throughout was what I would enjoy doing. So that's kind of what I ended up with.
Oh, I love it. I love it. I love the story how you're like, I'm here, there. I love everything. Mom, Dad, oh my God, this is going to be it. And they're like, oh, this is great. And then after the fourth time, they're like, okay, you know what? I'm not, just let us know at the end. Because every 6 weeks, we're hearing that you're switching to this other specialty. But also, the beauty about it is that you went and tested it all, right?
Yes.
Because now there isn't a lacking. Now there isn't a maybe I should have. You have done the true, tried and tested and saying, okay, this is definitely what I want. So, chose internal medicine to do like, true primary care. When did the geriatrics come on? Because those are my people. Shout out to my geriatric population.
I think anyone who goes through any medical training, when they interact with a geriatrician, you always leave with at least that's what you think, that this is the nicest attending that you've rounded with. And
Mm-hmm.
at least you have some certain level of calm. And
Yes.
so that's what I felt when I was in my geriatrics rotation, had a tremendous respect for all the
Mm-hmm.
geriatricians in medical school and in residency, but I never thought that I would do this again. It's like,
Yeah.
oh, this is not, and I decided, I graduated. I was the only person in my class that went into community primary care full time.
Mm-hmm.
And so I started doing primary care. And fast forward, I would do primary care for 4 years. And
Mm-hmm.
during that time, go through a series of things we might touch on later. But
Mm-hmm.
at the end of that, it was a question of walking away from medicine or staying? And then if I'm staying, well, what gives me the most joy? And I asked
Absolutely.
myself this question, and the answer was caring for older adults. And so I consciously made that decision and also instantly realized that there was a lack of knowledge and I wanted to acquire new skills. And that's why my answer to burnout was more medical training.
But it's also medical training to zone in on that population that you felt connected to and you wanted to serve in that respect. Alrighty, so now you're doing geriatrics. How is that going? How is the life of a geriatrician dealing with our lovely aged population? Tell me this really quickly.
Yeah. So I think that when fellowship was wrapping up and
Uh-huh.
there were multiple things happening at that time too, as is with life, I was really largely feeling a lot better with my burnout, but I was not completely healed. So the thought of
Mhm.
being in full-time practice was very challenging. And
Mhm.
as I am not a unique story, I'm the story of pretty much every other woman physician out there. When you're talking about going part-time, there's that instant feeling of like, oh, maybe it's like I'm less than.
Mhm.
But that was the only thing that I could see. So I practice clinically part-time right now. And in my clinical part-time role, I work with patients in the post-acute long-term care space and nursing
Mhm.
homes and rehab facilities. So for me, I further wanted time to slow down. And for me
Yes.
to have that flexibility to be with my patients, I wanted to be able to feel again. And I know that
Mhm.
it sounds this is very emotional, but I felt this way yesterday after rounds as well. When you're with your patients and you have that feeling of giddiness that you did in medical school,
Mhm.
and you have all these emotions rush in. I felt all of those things again yesterday and multiple times before that too, as I work with older adults, to the point that between going to different facilities, I sat down and I journaled about
Ah.
what I was feeling because it was
Mhm.
so profound. And I think I'm so grateful to have created this space for myself now,
Mhm.
after pivoting. So my clinical care is part-time and in the post-acute long-term care space, and I love it.
I love it. To be able to feel that same feeling that we had back when we were in school, where everything seemed rosy and you're bright-eyed, bushy-tailed towards this career that you spent a lot of time training and doing lots of exams and studying and testing and missing family, missing events, but it's dedicated towards this ending. To find out at one point in time that it's wow, I can't believe I did all of this and I'm not happy. That's one thing. To be able to restore some of that and find that giddiness again, that's super powerful. And it's also awesome. Now, one of the things that you've also done, in addition to creating this life, is creating this lovely institute that I love, Early Career Physicians Institute. What about the early career physicians drew you to saying, you know what, I want to dedicate some time to these physicians to help them through this process? Tell us what that made you do that.
We all have our calling that is shaped by the experiences that we have, and um, I want to put certain disclaimers before I talk because
Mm-hmm.
I think that we all acknowledge that our healthcare system is broken at large. The traditional system in which we work in requires a lot
Absolutely.
of work.
Mm-hmm.
But then also there are things that we can do, right? I can't wait for the system to get fixed before I start feeling empowered. It's a chicken and egg vicious cycle. Where do I go? What do I do? So
Mm-hmm.
that's the first disclaimer. The second is we all have our moments where we feel very overwhelmed. Either they are within medical training or afterwards. So while I felt the regular amount of exhaustion, which is a lot of exhaustion when you're a resident,
Mm-hmm.
I didn't burn out during my training because my program director and the systems that were in place were very supportive.
Love it.
My struggle came when I started as an early career physician because I felt that we have some flimsy protections in place by the
Mm-hmm.
now, and they're it's still a work in progress, but there's something that's there to protect you when you are a trainee, and then all of a sudden July 1st happens, you start your new
The
job,
net's gone.
it's gone. And I mean, it was pretty frayed to begin with. I'm not
Yes.
discounting that. And I know that many people have had terrible experiences during training. I thankfully was not one of those people. So
Mm-hmm.
afterwards, when you start as an early career physician, right, it's July 1st, all of a sudden you are in a new space. Even if you stay on in the same institute, you are working there in a different capacity after training.
Mm-hmm.
So then you're expected to know everything. You're expected to conduct yourself in a specific way. And when I say expected, it's a double-edged sword there. There's an expectation that is placed by the environment, and then there are the expectations that you've placed on yourself.
Mm-hmm.
And that's where I think largely a lot of my struggle comes in, because I'm a recovering perfectionist.
Mm-hmm.
I struggled with drawing boundaries. I thought that the only way to be better was the way I worked during training, which is like you say yes to everything.
Work harder.
That's right.
Mm-hmm.
But if you just keep doing that and you start as an early career physician, you can't just say yes to everything. So, in a nutshell, what I am doing right now is what creating support and resources that I wish were present when I had started off as a young attending,
Mm-hmm.
things that I would have been mindful of, or spaces or places where people would have said that it's okay, and you just emulate, and you just share that you don't need to know everything. It's okay.
Mm. Wouldn't that be wonderful? There is such a huge mind shift that happens, that you're right, that happens between June 30th and July 1st. There's panic, there's anxiety. And the challenge, I think, with us in this space is that we're constantly in a flux state, in that you had that flux state where once you enter into medical school, you're constantly in a state of flux. Like you enter in and you're a first year student, you're constantly taking tests and so on. And then you make it through the clinical years, even though I know some schools now they integrate that a lot, but you still have those quote unquote clinical years, or you're didactic and you're clinical. And then that's another flux state. And so now you're expected to know a little bit more because you're a third year. And then you move on to that, like you said, for those sub-Is or the sub or the acting internships. Well, you're an acting intern. Mind you, you're still a fourth year student, but you are now an acting intern. So now you are, expected to, you have now moved up the ranks. And then you start residency as an intern. There's another flux. You're at the lower portion of the totem pole, but you're still covering and you're expected to help the medical students. And then you move up the ranks. You become a chief. You're expected to do that. And then you move up the ranks. And then now you're an attending. And guess what? You're expected to know everything that ever happened in medicine. That's like how my 5-year-old, he is to me. He's like, Mama, well, do you know this thing? And I'm like, no. Well, how do you not know? You're a doctor. Like, did I just like everything and all knowledge that has ever existed in the world is supposed to just float into my head? And that's the mindset that we have once we transition from residency to attendanthood, right? And a lot of what happens is that state of fear and unrealistic expectations. And some of it we put on ourselves, and some of it, you said, the environment has changed. So now it's like, well, you're attending now, so you should fill in blanks, right? You're conducting yourself, well, now that you're such and such, you should conduct yourself this way, or you should know this. Like, how is it that you don't know this?
Yes.
Medicine is a lot of information. There's no way that we can know everything. Let's just be real. And it's constantly changing.
And I think that a really important part of this is also this, as you said, you're in a flux state, but we forget all the other parts of us that exist. We think that is a linear trajectory that's happening, right? You start,
Yes.
and now you're an attending, but what about everything that's happening outside of the clinical walls?
Mm-hmm.
Are you remembering that as early career physicians, there are so many other things that are happening in life? You might be settling down with a partner, finding a partner, having a baby, you already have babies.
Mm-hmm.
So many things are happening.
Moving across the country.
Exactly. Moving, all of these things, moving from outside the country. I mean, I know there's
Mm-hmm.
IMGs moving in, it's like July 1st situation. So there's so many things happening, and we don't acknowledge them. We are looking at everything in a very like singular way. I look back at my time. I had a
Mm-hmm.
1-year-old at that time, my first daughter, And I would go back at the end of the day and I would feel like when I crossed the threshold, I had nothing left to give. And
Mm-hmm.
as I was so driven at that time, I wanted to excel. So I took on all the projects. I used to write like love letters in basket to my patients. I felt like I was on the phone with them. I was there. I was actually practicing very good primary care. It's just that
Mm-hmm.
there's no space for that kind of primary care in the traditional model anywhere in the US.
Absolutely.
So
Absolutely.
who was going to tell me to take it easy? And who, if somebody did, who was I going to take seriously that they're actually looking out for me and this is not some, underhanded comment in some way? There's so many things. I felt that the medicine part of it, because like my boards had just gotten done, I felt on top of the world clinically, you know. It
Mm-hmm.
was everything else. Like you want people to tell you that it's okay to go home, that this is not a sprint, it's a marathon. And
Mm-hmm.
how are you going to set boundaries? What do you actually want from your life? Does anybody even talk about that? I mean, what are your 5-year plan? What are your 5-year goals? And so now, Dr. Beckford, recent MGMA data, I'm sure you might have seen this as well. Well, before, after residents would stay for about 5 years in their jobs,
Mm-hmm.
training, which I think is still
Yeah,
not
after the
a number.
first, yeah, after the first jobs out of residency. Yeah.
First job out of residency, and now that
Mhm.
number has dropped down to less than 2 years.
Oh,
And that,
wow. I
yeah,
did not know. That is a huge shift.
absolutely. And that makes you question, like, how is the onboarding process in institutes? How is,
Mhm.
we talk about retention, we talk about all of this. So as much as there is like this very strong moral case for physician well-being and investing in early career physician well-being, there's also a very real financial case. Like, what are we doing? And I always say at the end of the day,
Mhm.
I further had other health challenges happen. I'm very stable right now, thankfully. But as a patient, when I was on the other side and I saw my own primary care physician burn and out in front of my eyes, the same person who had helped me when I had suffered from postpartum depression,
Mhm.
and then subsequently they burnt out.
Mhm.
They were like struggling to
Mm.
provide care that was just basic. And I just like looked and I said, "What happened?" And they
Yes,
said that I am just so tired, I can't even tell you, because they knew like I'm also a primary care physician that
absolutely.
practiced it. They just like looked at me. And so as a consumer, I think that all patients should be very concerned about what is being done for their physicians' um, well-being. And then also, I think that a lot of conversations that I've had with non-physicians is
Mhm.
looking at doctors from a humane eye. Like one of my patients just said, like, I didn't realize you had a family for some reason. I didn't exactly.
You're just that robot that goes into the closet and shuts down at the end of the day, pipes back up and comes out and takes care of me. But you're right. And that's one of the that's such a great sentiment to this portion that we're going to talk about, which is we're humans too, and we go through human emotions and suffering. And that's why a lot of times it's so important to have community, because community will let you know that there are others who are suffering. But a lot of times we have so many silos in medicine where I am a doctor that's dealing with this emotional state. And because of, I think some of it is just a tradition of medicine overall, where we're trained to be the like resource and at last and resource. So when you now have broken down, you get the sense of I failed because I should know how to handle this. But as we know, having a bird's eye view, it's easier to handle situations from a bird's eye view than when you are actually the one going through it, right? So knowing that we are humans, we go through human emotions, we go through periods where we need help. That's it. Like we need help. We are suffering also. And we're suffering, and therefore that is decreasing our ability to provide the care that we so want. Because you said that you looked at your doc, and I'm pretty sure your doc was just trying their very best to just go through all the lists of stuff that they want to give you the best care possible, but they're just, then you said you
Yeah.
looked at them and you're like, wow.
I mean, you're so right. And you just look at it, the whole trajectory of what happens. This person had energy, they
Mm-hmm.
helped me, and like couple of years in, you see that you literally see the lights start to dim out, and the hair is all frazzled because I know exactly, because this is like looking in the mirror, right? Running
Mm-hmm.
between patients, and you're sitting and you're dealing with all the paperwork and you're looking, and I'm just like, all I asked for was, I think it was an A1C, because I was morbidly obese at that time, and that had happened because of my other issues that were going on, and having to meet resistance for just getting an A1C. And so I just like looked, I'm like, let's just like, I smiled and I said, hey, what's up? Like, what's going
Yeah.
on? And so I think that it scares me. It scares me from the future of my own health, my family's health. I love my pediatrician. If she was to leave clinic, I think I would follow her to wherever she's going. But these are real things. And when we
Mm-hmm.
talk about, hey, you need rest, you need to set a boundary, these are not abstract things that we're talking about in the metaverse. These are applicable, tangible things that you need to know. And there's no better way to start than when you are starting out. Like,
Mm-hmm.
that is a great point. And so pause, slow down. It's okay to say no to things. And
Mm-hmm.
for my senior and mid-career colleagues, you are so fabulous in just showing humanity. If you were to just like, hey, I remember way back when, and my colleagues did that to me, and I feel that the commiseration and the space for just acknowledgement, that was so helpful. Um,
Absolutely.
just, you can ask them a clinical question, but you can ask them other workflow question. But if they can just say, I remember being
Mm-hmm.
in your shoes, I remember how hard it was. And I remember that anytime my colleagues would say that, it would make me feel very validated. I would
Mm-hmm.
feel centered. I would
Mm-hmm.
feel in community. This is not a me problem. All of us have been here.
Yes, absolutely. Showing that vulnerability because it's a transition in the different periods of our lives is so important. And it doesn't necessarily mean, I know some people are private and some people are live out loud people, but there's a commonality that we all have, which is the commonality of moving from being a trainee to being now the attending, where the buck stops here. And if we really think about it, that's a lot of pressure. That a lot of people will see the infamous like comedic stories or memes about the intern in their first year and they're afraid to order Tylenol, because it's like, okay, this is my first order. But now when you really think about it, when you're signing that chart, like I specifically remember, and actually it's just almost like 14, 15 years ago, almost to the date, when I had my first shift and I'm sending home my first patient that was an atypical chest pain. And I'm like, this risk factor is very low that anything is going to happen. But it's the word chest pain and it's on the chart. And I'm hitting discharge. And I don't think I slept comfortably for the first 4, 5, 6, maybe the first year out of residency
Yeah.
as a attending. Everything you question, am I doing the right thing? Am I doing the right thing? Am I doing the right thing? And life still went on. Like I was still a daughter. I was still had a relationship. I was living in a state that, had moved across the country. So all of these things were going on in life. But to have someone say, that's okay, this is normal,
Yes.
you know, it,
It,
it adds so much peace. Go ahead.
absolutely does. It just humanizes the experience, because um, there's so much there. And in terms of like, when you are looking at colleagues and on the other side, right? When
Mm-hmm.
you're just told what to do, and we know orientation everywhere. Like, I don't think that there's going to be any place that comes up with a better way. This like drinking from the fire hose all the time.
Mm-hmm.
During that time, instead, if we were to not just ask about, hey, here's coding, billing, how to start working with this EMR, all these things, but if we had real check-ins, and
Mm-hmm.
these real check-ins can be done by colleagues, they can be done by mentors, they can also be done by coaches, like literally having that space available. If you don't feel that there's going to be conflict of interest, you can outsource that as well, or you can internally create that space. And I also want to add here something we should not forget as
Mm-hmm.
I work with early career physicians is a lot of the early career physicians that are now attendings did training during COVID, and they
Mm,
had scars from that time that are
that's
very difficult.
true.
At the time where, I mean, I think both burnout and moral injury was at its peak, where you just felt so
Absolutely.
helpless. And these are actual statements made by my clients, you know, struggling to find mentorship when you can't meet people face to face, and everyone's pulled to work clinically because there's a pandemic happening. When are we going to sit and talk about goals? So
Mhm.
approaching the early career physicians right now, I think we have to factor in all of these things.
That's a great point. In that, because right now at this recording, we're at 2024, and the pandemic was all full 2020. So, someone who was a first year med student during the pandemic is now, if you're doing, or even an intern, let's do an intern in a traditional 3 or 4 year residency program, they're literally an early career physician. And during their intern year, during the pandemic, there are a couple of things that happened. Like, one, they might have gotten like pulled to do excessive, like you said, like, shifts, or, and during a time where you would have been so afraid because we had no idea what this thing was that was, COVID, and people were dying. And if you are in your first year, you're already very, very, very low in the rank of understanding, like, what's going on. You're learning and you're training to have all those higher level um, way of thinking through the medical care of your patients. So it's kind of like you are being put in an environment where you have to work at your highest capacity, but someone was not available because they themselves were in the same situation where they're overworked. They are probably not seeing their own family, or they're afraid of bringing home this virus and killing their family. And so they had no time to sit and find out about you, no time to sit and to mentor you, no time to sit and to find out how are you doing, what are your goals. They, I guess they might be like, well, my goal is to make it through this pandemic, and I don't even know when it's going to end. There are just so many things that would have gone through someone's mind at that time. And so I can see how those who are finishing residency and now as early career physicians, it's not that there's a little bit of a loss, and I guess it'd be a little grieving process that we can truly acknowledge that has happened during that time. And it's a grieving from not being able to get the true mentorship that those in the previous years probably would have gotten. I never even really thought about, how that population of physicians are having to struggle. And here's the thing, they're not going to say anything because our particular field is not a field that we said, well, we never got any mentoring during, we just kind of suck it up and keep going.
Yeah.
But internally, we feel the loss.
Absolutely. I think grief and loss is a very good way to describe it. And expanding on that further, if you were training who also lost someone to COVID
Yeah.
during that time and being on the front lines and doing your job and caring for your patients, like there's an absolutely added burden to that.
Mm-hmm.
And this is a thought that came up to my in my mind randomly. This is a little bit on the side. I know we're talking a lot about the physicians that have started work or about to start work, and I also want to acknowledge the folks that are taking a break, that are
Mm-hmm.
going to not start clinical work because it's equally as hard.
Absolutely.
When you are going at 1,000 miles per hour and you have to stop that train, it's very hard. And you start questioning your purpose. What
Mm-hmm.
are you doing? Why are you slow? Like you needed to slow down to either take care of your mental or physical health, or you relocated, or you have a child, or something else happened, or nothing happened and you just want to slow
Need a
down
break. Mm-hmm.
and you need a break. And all of this is okay. So I really also want to normalize sabbatical. I also want to normalize going non-clinical, like all of these things. I think that there's a very specific tunnel view that we have, and we think that there's a very morally superior way to practice medicine, and anything and everything outside of it doesn't fly.
Mhm.
So I want to specifically acknowledge all of those physicians as well that are intentionally taking a break, and that it is okay. That does not make you less than. Your worthiness as a human does not diminish because you're taking a break from medicine for a little bit.
Absolutely. Absolutely. And that's a great point, because a lot of time we tie our self-worth, because we've dedicated so many years to this career or to the training to getting to this point. So if we don't go the next step, there are a lot of internal conflict that we have, the turmoil, the guilt, the emotions ride. Like, did I quote unquote waste my time? Am I using up somebody else's space? Could there have been another person? No, you were dedicated, you put the time in. So it's important for the longevity and peace of you as a person. If you need to take a break, it's important for you to be able to do so without guilt. Absolutely important. Well, now that we're even talking about that, a lot of times some people take breaks due to burnout, and it's very, very real. Let us know, have you experienced burnout? And if you do, what did it look like for you?
So I think that if any physician says, oh, they've never experienced burnout, they probably need to have a deeper conversation. Absolutely, I did experience burnout. And I think that the one really big episode that was chronic and started and kept on going happened in my early career years. And the worst part is that it happened in the first couple of months.
Mm,
And I refuse to acknowledge the signs and symptoms. So my first sign, if I really look back, and I've been thinking a lot about it, is I started having intense morning dread when I would park my car and have to go up to clinic. I just wanted the day to be over already. I just didn't have the energy to also get out of the car. I just felt that gradually I started going through my day to reach to the end and not like enjoying having a day. It's just like you just want it to be over and you
yeah.
just want to be home and you're so deplete. So I think the first sign was that and I said this before too. I used to get myself pumped up. You have good music, listen to
Mhm.
motivational podcasts. We have wonderful conversations such as yourself, all of these things in my ear. And yet, that next step is so hard to take. I think that was my first sign of
Mhm.
burnout. And then slowly, I mean, I was crisp even before the pandemic started. And then that was it. So during that whole time, I had my second baby, uh,
Mhm.
my daughter, and then after that, I struggled with postpartum depression both times, and the second episode was prolonged.
Mhm.
Um, so that happened, and then I had some other health challenges, and then the pandemic is happening. I'm also working. So the
Wow.
reason I say all of this is because that's life.
Absolutely.
And all of the time, I didn't share. I wanted everything to be perfect
Yes.
because sharing was acknowledging meant that I was less than.
Of course. That's how we feel. We should be able to, you should be able to handle all this.
Yeah.
When you look at, well, aren't your colleagues handling it? They appear to be handling this, right? So internally we tell ourselves there's a shame that we feel. And so we don't acknowledge, and we keep everything to ourselves.
Shame is a very apt word because I feel it rears its head all the time.
Absolutely.
And yes, I'm a coach and I have worked a lot on my healing, but burnout patterns are very cyclical. And the feelings that have been ingrained in us
Mm-hmm.
have taken years. Like medical training becomes part of your DNA. The way you think as a physician becomes a part of your DNA. And
Mm-hmm.
so every now and then you'll question yourself. You'll feel the shame and you'll question your worthiness. And your brain will take you to places where you have to consciously redirect it.
Mm-hmm.
So burnout started that way, and then I think that there was one day I can say for sure there were lots of tears in the middle. Morning clinic was done. After clinics it still needed to go on, and I sat in my office and I cried and I said, "Okay, I have to do something. It has to be something different. either just turn off this machine and completely walk away from medicine, or something else. And that's where the idea for my fellowship came in, and really
Mhm.
trying to like focus. And at that time I had already, I think the first step was to ask for help. And
Yeah.
so I had already sought counseling. I had at that time then also started, getting coached. And so all of those things were there.
Mhm.
Everything had to be on board. And
Mhm.
I would go back. I mean, the only thing I would tell my younger self, is to get help faster,
Ah.
because I'm going to attribute this to Dr. Michael Hirsch when he says that you can't read the label from inside the jar. So when
Mhm.
you just read a self-help book, or you just listen to a podcast and you try to apply that to yourself, sometimes you struggle. So you
Mhm.
need a human. That human can be anyone. You can start with a friend, ask anyone, acknowledge your struggle to any other person,
Mhm.
and then start your healing journey from there. And honestly, when you're that burnt out, talking to somebody else is more work. You would rather just clean out your in basket, finish
Mhm.
that note, and go home, instead of calling someone and talking to them. And that's how my brain was working. And the
Yes.
cynicism was at its
Very
peak.
high.
You people are talking to me about hobbies and what, I'm just like looking at them. What are they talking about? I haven't slept.
And then the thing is, too, like you're saying, you're just not able to find joy anymore, right? Like you said, someone's talking about hobbies. What hobbies? I'm just trying to find joy, and it's eluding me. So it's like you said, the energy to even talk to someone, it's gotten to that state that alone takes energy. And but that's the first step in being able to get the help, right? Others need to be able to know and know that you're ready to receive help. Yeah. Wow. So I love that you are able to paint that picture of burnout, because that's an apt picture that a lot of us go through. And you said something very important that I hope that people were able to capture, which is that burnout is very cyclical. So we went through it before, and you feel great that I've done it, but sometimes it rears its ugly little head again later on in life. And so once you can recognize some of the symptoms and recognize like how it affects you emotionally, like you start saying like, I remember this feeling, I remember this feeling. That's the time that you said that you start to intervene, so that you're not at it in its full mercy of burnout. You can try to intervene ahead of time by really just being astute and going back and saying, okay, I remember this feeling. I love it. Wow, so powerful. Do you have something else you wanted to add?
I love facts and
Mm-hmm.
data, and I know
Mm-hmm.
that a lot of us love that.
Mm-hmm.
So when we look at numbers and we talk about these things, such as self-care, such as self-compassion, I always felt like these applied to other people and not really to me. And
Mm-hmm.
even I felt that the burnout statistics apply to these other weak people. And I'm saying this, but they wouldn't apply to me because I'm stronger, I'm more resilient. They even tested our scores in residency, and I scored pretty well,
Yeah.
as I'm sure a lot of my colleagues did. But these are all applicable to you. So when you talk about that, this is the burnout stat, look around your room. That's the stat right there. When you talk about things as serious as physician suicide,
Mm-hmm.
we are all those numbers. So
Absolutely.
when you look at a number, look at a face. And that's why it is so important for you to intentionally live your life. I
Mm-hmm.
then also, earlier this year, I think last year, read 4,000 Weeks, Time
Mm-hmm.
Management for Mortals by, I think, Olive Mann. So, in that book, that's what you get.
Mm-hmm.
If you were to live the
The
average,
average person.
you get 4,000 weeks. Now you can look at it as a sign of depression, or like it's a depressing statistic. Let's just be honest. Nobody
Mm-hmm.
wants to talk about that. But then it is also incredibly liberating, because if you look at that fact, you look at the data, you look at where you are, you look at the amount of rest that you need, which is you need about 42% of your day to be rest.
Mm-hmm.
That is about 10 hours. I laugh every time I say that statistic, but if we don't follow that, Dr. Beckford, what's going to happen next? But if you look at the 4,000 weeks and the 42%, and you combine all the numbers and the data, if you are all scientists, we are all scientists.
Mm-hmm.
And we are in those statistics. Why are we not prioritizing more intentional living? And yes, the systems are all broken and these numbers are still there. So, what are you going to do? That's the important question.
Absolutely. The numbers are there, and it's going to be there not just for you, but for the other physician who's entering into the field. Is for every person. Once you're born, the average number of weeks, you get 4,000. So, are you going to get depressed in that you're like checking off these weeks, or are you going to be intentional and getting the most and living life to the fullest, creating the joy, creating the magic, that we are all intended to be on earth to receive? And that's what you said, intentional living. I love it. Now, with that, I have a fun question that
I'm
I
so
asked.
surprised.
Oh, my doc. Oh, yes. All righty. So, if you weren't a doctor,
Hmm.
geriatrician, if you weren't a coach,
Hmm. Okay.
I know.
It's getting harder.
Let me think of anything else. Yeah, so we did like, so you had a dermatologist that had an impact in your life. Mom and dad are physicians. Boop, knocked out that category. And you did coaching, wellness coaching, did geriatrics, worked at a nursing home. I'll allow you to do something in a nursing home, but you can't be a doctor in a nursing home. But what would you be?
I would just write. I would try to be a serious author and I would
Oh,
write fiction.
ooh.
I think if I was to completely take out any form of self help, that would be. I actually started writing a book with two other friends when we were in fifth grade. It was a story. We would circulate. There was no set plot, hence it's not published, but we still have it. So kind of, I would write a chapter, would send it to the next friend who would take it from there, write, and then move forward. But I did enjoy writing, and I
Mhm.
would also write poetry back in the day. So English literature, and that really was a passion of mine.
I love it. You know that there was a mystery, a group of mystery authors who, like, I know Agatha Christie, I can't recall some of the others that did that
Agatha
same
Christie
thing.
was my favorite.
Oh, she's my favorite. I listen to and I read all this stuff all the time. But that's for another episode. But they did a mystery book just like that, where everyone wrote a chapter. And so I think it was something about the chocolate. There was something about,
I'm also thinking about something, but it's not coming to my head. But I kind of follow what you're talking about.
yes, it was something about the chocolate thing, whatever. But it was a great mystery that was written, a chapter written by the different authors. So my whole point is that book from fifth grade does not need to end. We can pull it back up, and all the authors can continue. We can get that published.
Thank you for making me remember that. These are the things that sort of complete us. And now that you've asked me this very insightful question, which
Yes.
I think that I would also maybe invest in drama and acting
Mm-hmm.
because that
Mm-hmm.
that was another thing that was a passion from school.
From
And then
school.
I think that the more I got immersed in medicine, I somehow felt that I had to be very serious. And there
Yes.
was a very comedic side of me, and there was all this the dramatic side of me that I completely left. And maybe at some point I will resuscitate that.
Of course, absolutely. And that's the part. That's why I love this question so much, because it's our creative question. And rest assured, all of you will be in my utopia, which is my very, very, very great Dr. Beckford's group of awesome friends utopia that's doing awesome things. But yeah, there's so much joy and passion that we had as kids, and our imagination ran wild, and we can do everything. And you aptly said, once you went into this profession, you were told you need to be serious. And then we forgot about our like joyful self. So I love that question because it helps to bring that out. Before we end this wonderful conversation, I just wanted to thank someone who stopped by. Stuti Iman says your conversation is so insightful. I loved it too. I love it too. I think it's a great conversation. And I can can go on and on and on forever, but we do want to respect all of you guys' time, those who are listening, those who are watching, and of course, Dr. Amna. So let all those who are watching and listening know how can they find you. They're early career physician. They just graduated residency and they stepped out into this new attendant life, and they're not really sure which way to go, but they're looking for some guidance and support and some coaching. Where can they find you?
Thank you, Dr. Beckford. Earlycareerphysician.com
Mm-hmm.
has a lot of free resources. One of the main things that everyone struggles as an early career physician and maybe even later is boundary setting. So I have a free ebook that's available, and it's titled Things I Wish I Had Known on Day One. So of attendinghood, I would recommend everyone to go to earlycareerphysician.com/ebook to get that ebook. And
Mm-hmm.
then you can find me with my name on Instagram. It's dr.amna Shabbir. And I'm also
Mm-hmm.
on LinkedIn, also on Facebook. So here for you. Please reach out if I can support you in any way. But know that you matter and what you're feeling is not imaginary, and asking
Mm-hmm.
for help is okay.
Absolutely. Asking for help is okay. Lovely, lovely, lovely. Thank you so much, Dr. Amna. Now, I know some people, there I go. I get it all the time. Oh, my goodness, Dr. Beckford. I jumped on during that last part and I didn't catch everything. And I said, have no fear. This wonderful conversation is available on our Your Caring Docs website. That's URCARINGDOCS.com. Select podcast and you'll be able to see and download this wonderful episode. You'll see Dr. Amna's beautiful face. Just click that download button and send it to at least 10 of your friends who you know would benefit from this. If you know someone who just graduated and they want to be able to get help, or just that reassurance that, things will be okay, or this is normal, or this feeling that I'm feeling, yes, it's okay to ask for help, then of course share this wonderful conversation with them. Now, if you are looking for a dynamic speaker for your next conference to speak about burnout, stress management, then I'm that person, right? Send me an email at drbeckford at yourcaringdocs.com. Or if you can't remember, you can go to my website. That's URCARINGDOCS.com. Click the work with me button and you'll be able to connect with me, and we'll see how we can make your next event your best event. With that, we're going to end this wonderful conversation. Thank you so much for those who were listening. And thank you so much, Dr. Amna Shabbir, for helping our early career physicians so that they can continue to live life and do what they want in their early, mid, or later phases in their career. And do that with the passion that they know that they've worked so hard for. With that, we're going to end this great conversation. Thank you so
Thanks,
much for
Dr. Beckford.
joining.
Thank you.